Putting on visceral adipose tissue is very easy, and it usually bounces back quite quickly and probably to even worse extent than it was present before the intervention. But all in all, unless you're pregnant, you can get DEXA, no problem. There are also other fat indices like fat mass index and concerns at what body fat percentage I will see my six-pack. At least our goal should be not to allow further decrease, particularly into the territory of osteoporosis, but we also get the grasp of the body symmetry. I suggest aiming as high as you can possibly achieve, with genetics ultimately becoming your absolute limiting factor. And if that's not the case, we must take action. One of my clients, a lovely gentleman who's been trying to lose weight, combining serious caloric restriction and exercise, both resistance and aerobic training, has invested more than a month of effort very diligently, and he was very disappointed to see that his weight on the scales, despite all the intervention, has changed very little. He literally lost just 2 kilograms. But when I explained to him something that we will look at in great detail in this video, he actually became very happy with the outcome of his effort. Weight on the scales and its derivative, body mass index, which is weight normalized for height, are far from ideal metrics. They can and they should be used as everyday accessible check and compliance tool, but because they don't distinguish between the types of tissue and only reflect a cumulative total formed by fat, lean tissue and bone tissue, just by checking weight and BMI, we can't get any idea about how the mass of each of these contributors changes in response to what we do. In this video, we shall discuss the best way of evaluating body composition and how to interpret its findings to guide our dietary and exercise interventions. The gold standard for body composition assessment is DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry, and it is essentially a very low-dose X-ray of the whole body. And obviously when we hear X-ray and radiation, we need to understand how safe this is and how often we can perform this investigation without harm. The radiation produced by DEXA varies depending on the scanner that you use, but on average it's minuscule and in the realms of 1 to 10 microsieverts. In comparison, just living a year at the sea level produces the average background radiation exposure of around 3 millisieverts, which is 300 to 3,000 times more. A single chest X-ray is 100 microsieverts, a mammogram is about 400 to 700 microsieverts, whereas a CT chest abdo-pelvis is 10 millisieverts, which is equivalent to 3 years of sea level background radiation. Essentially, with DEXA scan, we get radiation exposure equivalent to somewhere between 3 and 30 hours of background radiation at sea level, and much less than most medical X-ray and CT imaging. So this technique is really safe, and the only real contraindication is pregnancy. There are also certain conditions and situations that may affect the ability to perform DEXA and the quality or reliability of the results. For example, if the patient has significant spinal deformity or inability to lie still for the duration of examination, it will render DEXA scan impossible. Also in the cases of extremes of BMI, very, very high, very, very low, as well as if the patient has implants in the body, the results may not be as reliable. Also, if you've recently had an oral contrast like barium swallow test or a radionuclide scan, you may consider to wait several days or weeks for it to clear out from the system before getting your DEXA scan for reliable results. But all in all, unless you're pregnant, you can get DEXA, no problem. So how often we should be doing DEXA? If we're talking monitoring and we don't intervene, then it could be done every 1 or 2 years just to have a checkup. However, if we're talking intensive lifestyle intervention with nutrition, exercise, we need to be looking at our progress more frequently, and then we're talking once every 3 to 4 months. Before you go get your DEXA scan, it's important for you to understand what kind of output will the specific institution provide, and if they're actually going to provide all the metrics you need to see within their report. And ideally, we should be looking at getting our DEXA scan at the facility which provides in their output document a minimum of 4 components: bone mineral density, BMD, VAT, which is the estimate of visceral adipose tissue, as well as two lean indices, appendicular lean mass index and fat-free mass index. In terms of bone density, it's also valuable to make sure that this specific institution where you go to do your DEXA scan distinguishes between a lumbar spine and hip z-scores and provides separate values for them rather than just a cumulative z-score for the whole body bones. In the latter case, it will be difficult to correctly judge on the presence of osteopenia or osteoporosis. Of course, if you're a young individual, an athlete, or you've done DEXA recently which has shown no osteoporosis, then you don't necessarily need this specific information on each of your DEXA scans. But if we are talking about more senior individuals or someone who has known osteopenia and osteoporosis and who's intervening to improve these exact metrics, then having a detailed breakdown for hips and lumbar spine z-scores is important. So how does DEXA work? When we lie down on the DEXA table, we get the X-ray of the whole body performed. And there is a special plate underneath our body which receives the ionizing radiation as it passes through our tissues. And depending on the features of different tissues, they will absorb different amounts of ionizing radiation, resulting in different amount of X-rays reaching the plate. Ultimately, what we will get is this color image of the body, with blue representing bone tissue, yellow representing high fat percentage areas, and orange and red reflective of the tissues with low fat percentage. To put it simple, we'll get to distinguish between bone, fat, and everything else. And this everything else is referred to as lean mass. And it is composed of muscle, connective tissues like tendons, ligaments, and skin, organ tissues, and different bodily fluids. But most of the times, we refer to lean mass as a proxy for muscle mass. And once we've done DEXA, we can see how much fat and lean we've got, and the intent is to see less fat and more lean, of course, and how strong our bones are. In addition, DEXA shows us how these components are distributed in different parts of the body. For example, left and right arm, left and right leg, trunk, and head. So we can not only judge on the body composition, but we also get the grasp of the body symmetry. And in case there is some outstanding asymmetry, this is something we can take further to kinesiologist or physiotherapist and work on that and rectify. Let's look at the first metric, which is bone metrics. DEXA gives us BMC, which is bone mineral content per body part, and BMD, which is bone mineral density. And this latter is reported in absolute numbers in grams per centimeter squared and as Z-score and T-score. The main parameters we're looking at in clinical practice are these T and Z scores. T-score compares your bone density to that of a healthy population of your own sex aged 20-29 when the bone density is at its peak. For example, if you are a male and you have a T-score of minus 1.0, it means that your bone density is 1 standard deviation below the median of a young, healthy 20-29-year-old male. And in practice, we use T-scores for women after menopause and for 50-plus-year-old males to check for osteopenia and osteoporosis and assess for the aging-associated fracture risk. And I'll put a table here, you can have a look. The Z-score compares the bone density to an age-matched population of your own sex. And this is something that we use to evaluate bone condition in children, premenopausal women, and men aged less than 50. I tend to interpret a Z-score of less than 0 as a red flag which requires intervention, particularly in younger individuals. So how can we intervene to improve our bone mineral density? The mainstay is resistance training, so lifting heavy weights to load the bone and promote its remodeling, mineralization, and strengthening. And that needs to be complemented by adequate nutrition with appropriate amounts of protein, calcium, and vitamin D. And also for women in perimenopause, it's essential to consider hormone replacement therapy because adequate estrogen levels are essential for bone health. Depending on the age when we start addressing bone mineral density, we may not be able to increase it significantly. For example, if we start late, but at least our goal should be not to allow further decrease, particularly into the territory of osteoporosis, which will represent a fracture risk. All in all, the earlier we pay attention to our bone mineral density, the higher is the likelihood that we'll be able to address it at the stage where it's still malleable to change. Before we move forward to fat indices and lean indices, we need to understand how they are presented in the DEXA report. So the concept of absolute numbers, whatever the units are for the specific metric, and the concept of percentiles. Different parameters evaluated by DEXA can be reported in absolute values. For example, let's have a look at this DEXA report, which shows the fat mass in the right arm as 1,617 grams. This is the absolute number in grams. At the same time, there are age and sex specific nomograms for different parameters. And essentially, these are reference graph charts that allow us to interpret where the patient's personal value lands compared to the relevant population group. Being at the X percentile means having that parameter higher than X% of the reference population. Usually on your DEXA report, you'll see two types of percentiles, YN and AM. YN stands for young normal, and it plots your value against the people of your sex aged 20-29, so young healthy. On the other hand, AM stands for age matched, and it plots your value against the people of your sex and the same age bracket as you. If we get back to our example of the patient with the right arm fat mass of 1,617 grams, we can see that for this particular patient, it corresponds to the 81st AM percentile. And now we can understand that the amount of fat tissue in his right arm is higher than that of the 81% of the people of same sex and age group. In essence, we want lower percentiles for all our fat indices and higher percentiles for all our lean indices. And whenever I will mention a percentile goal for a specific index in this video, I shall be referring to age-matched percentiles, the ones that show AM on DEXA. Now, let's look at the DEXA fat indices. First listed in your report will usually be the total body fat percentage. Total body fat represents a combination of the fat under our skin, the subcutaneous fat, and the fat around and inside the internal organs, the visceral fat. Fat tissue in general is not something bad or something we should be ashamed for. It's a natural storage solution which has evolutionarily developed so that we can store the excess energy and then mobilize it from there when we need it. And specifically, subcutaneous fat is the right place to put this excess energy in. However, the storage capacity of the subcutaneous tissue for this fat reserve is predetermined and limited in each given individual. And if our caloric balance is in such surplus that we exceed this storage capacity in the subcutaneous tissue, then further excess energy, further fat will overspill to fill up the space around organs like liver, pancreas, and heart, and also within organs and including inside organ cells, like inside the muscle cells. And this forms a metabolically active visceral fat tissue, which produces multiple molecules that negatively affect health via insulin resistance, systemic inflammation, and so on. And surprisingly, there can be people who have high total body fat, but at the same time, low visceral fat. So the majority of their fat is subcutaneous. And also it can be vice versa when the person looks quite skinny and their total body fat is in the 30th percentile, but their visceral adipose tissue is in the 90th percentile, which is extremely unhealthy and puts them at high risk. So it's not just the total body fat percentage we're interested in, but more importantly, for the context of health and longevity, it is the VAT estimate, the amount of visceral adipose tissue. Now, what do we consider a good VAT value on DEXA? Despite seemingly okay being average, that is at the 50th percentile in the modern Western society, will put us at a very high risk for cardiovascular disease and type 2 diabetes. And that's why we should ideally be aiming VAT below the 25th percentile for our sex and age bracket. And also, as a rough guide, we can consider that we aim VAT area of less than 100 centimeters squared, although it can be less than that. But more than 160 centimeters squared represents high risk as well. Another thing to remember about visceral fat is that it increases with age. So the older we are, the more grams of visceral fat we can have in order to fit the lower percentile. But as a rule of thumb, if we are over 1 kilogram of visceral adipose tissue at the age 40, we're probably hitting around 50th percentile. And if we are above 500 grams at the age 20, we'll be well above the 50th percentile. So what tools do we have that would enable us to leverage the amount of visceral adipose tissue in the correct direction? We're mainly speaking nutrition, particularly caloric restriction and dietary changes, such as cutting out refined carbs, added sugars, and alcohol. We're also speaking exercise in the form of combination of zone 2 and strength training. And of course, we're talking adequate quality sleep, as it is proven that poor sleep is linked to hormonal dysregulation that ultimately promotes visceral fat storage increases. And I would also like to add that visceral fat is quite resistant to intervention. When we intervene with caloric restriction and exercise, we see subcutaneous fat responding quite well, whereas visceral fat is somewhat very slow to respond. And that's why if you had an effective reduction of your visceral adipose tissue, I would suggest please don't go back to your previous habits, because putting on visceral adipose tissue is very easy and it usually bounces back quite quickly and probably to even worse extent than it was present before the intervention. And the older we get, the more difficult it would be to get it under control. There are also other fat indices like fat mass index and concerns at what body fat percentage I will see my six-pack, but we'll leave them to another DEXA video or maybe shorts where we can delve more into these less crucial metrics and instead move to check on the lean indices. And there are two of these lean indices: appendicular lean mass index and fat-free mass index. Appendicular lean mass index is the muscle mass in our extremities, so arms and legs, normalized for the height. So we take the extremity muscle mass in kilograms and divide it by height in meters squared, and that's how we get this index. This is the most direct proxy for skeletal muscle mass, and it corresponds to strength, metabolic health, and longevity and resistance against aging. Low appendicular lean mass index reflects sarcopenia, so insufficient muscularity, and it is linked with frailty, risk of falls, worse metabolic function, reduced lifespan, and so on. And in terms of goals for this index, I suggest aiming as high as you can possibly achieve, with genetics ultimately becoming your absolute limiting factor. A good goal will be to get above the 75th percentile for your age and sex, so the age-matched percentile, AM, whereas the sky's the limit and you can aim 97th percentile and above if your goal is the best odds at living long and healthy. The main tools to improve our appendicular lean mass are resistance training, adequate supply of amino acids, so intake of protein in the realms of 1.6 to 2.2 grams per kilogram per day, spread in 20 to 60 gram portion across the meals of the day, and adequate recovery, namely high quality sleep. The second lean index that I've mentioned is fat-free mass, which is essentially a total of all non-fat tissues in the body, including muscle, organs, bone, and water, normalized for height. This index, in my reading and in the reading of quite a few other longevity physicians, is a little bit secondary as compared to appendicular lean mass index, because it also factors in non-muscle tissue. So whenever there is a discordance between fat-free mass and appendicular lean mass index, it's best to focus and target the percentiles for the latter. So essentially that's it. These are the main parameters to look for and interpret in your DEXA scan and to target with your interventions. In 3 words, we want to see lower percentiles for fat indices, higher percentiles for lean indices, and a Z-score above 0 for bone mineral density. And if that's not the case, we must take action. If you would like me to interpret your DEXA and give you a clear plan with all the progressions to improve the metrics we've just discussed and more, check the link for my consultations in the description section below, and I'll see you again soon in the next video.